We're taking you live now to Sydney, where authorities are giving an update on the status of coronavirus in New South Wales.
The epidemiology and the clinical features of the disease, but we have experts of world renown in New South Wales who are helping assess the situation, have developed accurate tests to diagnose patients with coronavirus should they occur. And we've been providing updated information to clinicians across the system about what symptoms to look out for in patients, how to manage patients and how to diagnose patients with the disease. Now, China has a flu season at the moment, and so there's not unexpected that people travelling from Wuhan will present with symptoms that could be consistent with coronavirus. And so, as part of the response, we are working with the Australian government, who is responsible for quarantine of international flights, to support the biosecurity officers at the airport in Sydney, where 3 direct flights occur every week from Wuhan to Sydney, to support the quarantine officers there in managing anyone who identifies as being unwell after travelling from Wuhan into Sydney. Now, with any infection, such as coronavirus, there's an incubation period, which means that people won't be sick or have any symptoms at all for some days after being exposed to a virus. And so finding patients at the airport is not foolproof by any means, and so that's why it's important that people who have travelled to affected areas in Wuhan and they have the symptoms to be aware of those symptoms and to call ahead before they see their doctor, so the doctor can prepare so that the person is appropriately isolated so that other people aren't placed at risk, and the doctor can prepare with the appropriate infection control. Now, of course, many people who present won't have the coronavirus because of the prevalence of influenza and other such infections in places in China, like in China at the present moment. But we need to make sure we've got the system set up in place.
Can you tell us what powers, because it's now a notifiable disease, what kind of powers would GPs have if they believe someone may have it to take people directly to something else?
So coronavirus 2019 is now a notifiable condition in New South Wales, which means that patients who are suspected of having that infection must be notified by their doctor or laboratory or hospital to public health. Under the Public Health Act, if necessary, people can be placed in isolation, and people who are in contact with patients who have the infection can also be placed in quarantine. Now, almost always we don't need to do that because people are very sensible and cooperative, but we do have powers, if need be, under the Public Health Act to be able to control the spread of disease. Having said that, the information we have to date is it does not appear that this virus is particularly infectious, although there have been cases transmitted to healthcare workers confirmed in China. But the preliminary information we have is that it doesn't seem as infectious as SARS, which occurred 15 years or so ago. However, we can't assume. We're still learning about this infection, and internationally information is being gathered every day about how it's being transmitted, how long it's infectious for, how long it is between getting exposed and getting symptoms, or the incubation period. So gathering that data is really important to help us inform the public health and clinical response.
Doctor, how does the screening at the airport actually work? Like, who does it? How many people will be out there? What will they be looking for? How's it going to work in practice?
So routinely, when an aeroplane is travelling from overseas into Australia, the captain, when about to land the plane or coming down from descent, must report to the border security people biosecurity people about whether people are sick on board. Now, we understand China has implemented exit screening from Wuhan, meaning that people probably won't be getting on the plane from Wuhan if they're already sick. So that's one measure that's already in place. It reduces the risk that people will be flying in unwell. But routinely, aeroplanes are required to notify the border people when somebody is unwell on the flight, and then biosecurity officers will meet the flight to assess that person and then seek advice from New South Wales Health about how to manage that person. Now, during this period of concern with coronavirus, we're enhancing that. We're having health staff attend the airport in person to assist those biosecurity people to assess anyone who's unwell on the flight. And if it looks like they may have an infection, and again, an infection would most likely not be coronavirus, it might be influenza, but it could be coronavirus, we can arrange for testing and management of that person right away.
Would you put them in hospital or what? Where would they go?
So we have arrangements with our facilities, depending on how unwell a person is. And again, we don't expect people to be particularly unwell, having been screened before getting on the flight. Westmead has an arrangement for expertise at Westmead Hospital to support patients and rapidly diagnose them. But if a person's very unwell and needs to go to a close hospital, that would be arranged as well.